Health and Human Services Secretary Xavier Becerra spoke exclusively with CBS News about inequalities in the American healthcare system, the impact of the pandemic on mental health, and other issues the country is facing. Here's part of his conversation with CBS News correspondent Enrique Acevedo.
In an op-ed published in the USA Today this week, a group of African-American leaders, the op-ed was titled, "We're not going back to normal, we died in normal." This group of African-American leaders wrote that Black and Latino communities continue to die from COVID-19 at a rate that's nearly double the white population, mostly because of lack of access to healthcare, quality healthcare, pre-existing conditions, and also with the vaccination rates that are getting better, as you said. As the first Latino to be the head of Health and Human Services, what are you doing to close this gap and make sure those inequities are not here after the pandemic?
There are many Americans who were not equipped health-wise to take on COVID because they had not been taken care of well, or they hadn't taken care of themselves well when it came to their health. Too many Americans, especially Latinos and African Americans, lack health insurance. Too many of those Americans lacked good access to care. And so when all of a sudden the COVID wave hits, they're the ones most likely to drown. What we did was we didn't wait for those folks to wash up ashore in need of help. We went out and searched for those communities that often are left behind. And we said, look, we've got something really good, and you can afford it because it's free. And as I said, we changed the dynamic when it came to vaccines. We did the same thing when it came to enrolling people in health insurance under the Affordable Care Act. We increased the numbers dramatically. And we're going to continue to do that because every American should have not just health insurance coverage, but the peace of mind that comes with it.
Another reason why Latinos and Blacks are getting infected at a disproportionate rate and dying at a disproportionate rate is that they're overrepresented in the jobs that we have deemed essential. And sometimes working conditions on those jobs are less than ideal, to say the least. How is HHS coordinating with other agencies to make sure that changes as well?
We want to make sure that Americans who are characterized as essential workers aren't seen as dispensable Americans. They should be indispensable if they are essential workers. Yet, as you pointed out, they were doing jobs that essentially made them very dispensable in the eyes of too many people, including their employers. That, we hope, will change. Why aren't we treating those who made sure our food came to us safely from the grocery store, those who made sure that our waste and garbage was picked up properly? Why aren't we treating all those folks who had no choice but to go into work, not through some virtual screen, but go into work? Why aren't they being treated as indispensable? We're doing that, and that's why I say we go to them. We don't wait for them to come to us.
A CDC study shows that nearly 1 out of every 500 children in the United States is experiencing COVID-19 associated orphanhood. Children of racial and ethnic minorities, again, accounted for 65%. 65% of those who lost a primary caregiver due to the pandemic. We're talking about 140,000, 150,000 children here in the U.S. What are you doing to ensure that these kids have their basic needs covered, including love, security, and daily care?
We have initiated some programs that provide services. It could be the initial bereavement and funeral services, which unfortunately the families have to worry about, but we do that. We then try to follow up with them as best we can, working with our state and local government partners because most of those programs are administered locally. But the President has made resources available through the American Rescue Plan for us to be helpful to these families, especially to these children. And one of the things that we're doing that I hope will be instrumental in letting all of us, including these children, get through COVID is that we're going to be devoting far more resources towards mental health care, making sure that families and these children have access to the mental health services they need, because we've seen how, unfortunately in this country, mental health is almost still treated like a stepchild to general health, physical health.
At a very personal level, it feels like all of us know someone who's died from COVID. We have either a friend or a close relative that lost their lives to COVID. How do you personally cope with that? I'm sure you're not an exception. And what do you tell others that are struggling to heal.
Enrique, there's nothing more important I can tell you than going to someone instead of waiting for them to come to you in desperate shape. When we wait for them to reach us, it may be too late. They may not be able to breathe anymore. They may need to go into a hospital, use a ventilator. Why wait till they get to that point? Let me find you where you are and help, whether it's COVID, getting you vaccinated before you get sick, or whether it's trying to make sure that you as a child who have lost your parent from COVID, we don't wait till you manifest the signs that you're having a really difficult time emotionally and mentally in dealing with that. Let us come to you where we can to offer services.